road between this and this. So we just reconnect with. We reconnect. We have one.
Forse ti lascio andare, poi ti racconteremo, tanto succederà niente di essenziale da quello che... Sì, sì, sì. Ma certo, no, abitudine, come sono 20 anni che li frequento. A presto, ciao ciao.
Okay, now we are ready, I think, but we have to share. Well,
Yes, okay.
yes, here we're okay. Okay, yes, now we can share that. And yes, so I'm saying again, we begin at 19, and from 2020 until now, ongoing expansion of Olcan Greece made that the largest joint initiate for cancer care in our country, with participating of 22 major stakeholders. So first of all, we have to see what the landscape, to identify the landscape. So cancer was the second leading cause to death in Greece, and the first over the 70s. And also we had 10 years of financial crisis, with fiscal austerity measures led to aggravation of an already insufficient healthcare system. Of course, as you mentioned, and you also have problem in Egypt, we didn't have national cancer plan and national cancer registry. And there was the potential to have a better collaboration between policymakers, patients, the scientific cancer community, research institutes, and healthcare providers. And of course, we have to take under consideration the health system challenges, barriers in access to innovation, lack of screening program, delays in radiotherapies and surgeries, and understaffed hospitals. This was the landscape. So we developed the All Can Greece initiative. But in this initiative, we wanted and we had different stakeholders. First of all, the scientific cancer community, the Society of Medical Oncology, Surgical Oncology, Young Oncologists, Pathologists, Radiation Oncology, and of course Oncology Nurses Association and Society of Hematology. Cancer patients are represented by Hellenic Cancer Federation, and we invited to participate the academia in health economics mostly, because you know all of this has to do with health economics. And so we have as partners the University of Athens, of Piraeus, the University of Piraeus, and the Laboratory for Health Technology Assessment, University of West Attica, and the Department of Nursing, University of Peloponnese. Healthcare units had to be part of this, so we have two major stakeholders, the Department of Radiology of the University Hospital of Iraklion, Crete, and the Department of Oncology of the Attikon University General Hospital. And of course, we had to have research institutions. So Center of Research and Technology in Thessaloniki is partner and stakeholder of Olcan Greece, and as knowledge partner we have the consultant company IQVIA. And we want to have sustainability, so we had to have funding. In this first step, three pharma industries participated as funding members, funding stakeholders, but now we have raised this number, as you see, because producing work has to do with also with sustainability, and more partners ask to be in this initiative. Here, in other words, you can see that we wanted to develop a community of doers. We wanted to develop a core that will work to change the situation. And here you can see the steering committee and under the logos of the organizations that they represent in Olcan Greece. Our priorities was to build dialogue with stakeholders, to conduct research, provide evidence-based recommendations to the government, and disseminate the outcomes. Here you see that we had to raise awareness. We had to make people to know, to understand what is Olcan Greece. So we had road trips all over the country, and we participated in scientific congresses to inform all the scientific community mostly, but also the policy makers and the people who are take the decision makers in health sector about what is Olcan and what we are doing. And of course we had a press conference and also participate in some events, just like the Athens Marathon, the authentic. If you have someone next year, you will be welcome to be invited and participate our team. And, but you cannot speaking without evidence, and we have evidence, you have evidence, but we must structure this evidence in order to produce the result we want. So we made one survey, the big survey of Olcan, back in April 2019. In this survey, we make a mapping of the experience of cancer patients and identify and prioritize the needs. So, you know, Olcan has as priority what is important for the patients, and this is how we can have, in other words, have efficiency in cancer care. After that, we made two studies with the University of Piraeus, and you see the two posters in ISPOR last year, November 2023, were published, these two studies. And you know, these were the first studies about these outcomes for cancer care in Greece. Never been done something like that. And after that, we made a study with the University of Athens for quality of life of cancer patients. And of course, we made two surveys during the pandemic to see how pandemic affected on their life and the problems with the care system. We made the period of pandemic was very crucial for us, because at that time we managed to identify problems, to work together as team closely, and to make recommendations to the government. For instance, one recommendation that was accepted from the government is the expand of the operation time of the radiotherapy in Greece. 3 o'clock was finished the operation of radiotherapy, and we had delays more than 3 months. Now the delays are about 20 days because of the expansion of the working time of the radiotherapist departures in the hospitals. And of course, we had to disseminate these studies, and we made webinars, and we invited people from the government, for the health ministry, to show this, to present these results and to make suggestions. And if you can see here, the last one, the lack of framework for the approval and reimbursement of biomarker testing. In Greece, there was only one decision from the Minister of Health back in 2014 for the approval of 2 biomarkers. Until now, we don't have a framework that will have to do with the approval and reimbursement of biomarker testing, which is crucial for access to innovation, to precision medicine, and all the new tools. So we worked with the government, and in our last event back in November, the Secretary of the Ministry of Health is here in the picture, one of the two tall guys, and the other one is the professor of health economics. We developed a model and presented to the ministry, and the ministry accepted. So the next month we will have this framework, and we will have the approval and reimbursement of 10 biomarkers and some NGS testing. But, you know, to address all these challenges, we had to work and to make some suggestions. So earlier, Professor Hezam mentioned the National Cancer Plan, and Professor, I don't remember your name, I'm sorry, yes, the National Cancer Registry, two very important pillars if we want to talk about structured cancer care. So back in January 2023, we presented, in collaboration with all partners, this white paper with the suggestions for the development of a national cancer plan. And after that, we made an event in the office of the Europe Parliament in Athens, presenting all this work to the minister and to the other policy makers that have to do with this. And as the result, by September 2023, we had, as all can, a meeting with the Minister of Health, who for first time in Greece in September 2023 announced and committed that the country will have a national cancer plan, a national cancer registry, and a national cancer council. We don't have not an institution in Greece. On April 2024, we managed to have the right to be forgotten in Greece with the Minister of Economics, Financials, and also the President of the Union of Insurance Companies. So we like and we try to address inequalities, financial inequalities. And in the same time, by doing all this back in Greece, we are looking and trying to collaborate with Allcan International. We're trying to promote all Allcan actions, surveys, researches, and participate in this. And as you see, the action guide for efficient cancer care, and what earlier Eduardo Pisani mentioned, is one of our next targets. We are looking forward to develop a collaboration and make a pilot implementation of this metrics and this guide in our country, in some hospitals. Of course, as I told you, we had to communicate and to disseminate all this work so the policymakers and the decision makers will be aware of that. And I'm trying to be as fast as possible, looking forward for the future facilitators and challenges. Why I put that here? Because I believe that we have to do all the time SWOT analysis, and we have to understand what is the landscape at that moment that we are working, so we can make strategic choices for the future. Well, at this time, last month, fortunately, launched the National Cancer Registry in Greece after 1 year and 4 months. And we were collaborating, and when I say we, I mean all the scientific community and myself as a representative of HELOC, in a working group that was created by the Ministry of Health. We worked for 18 months and we developed this registry. It is now launched last month. Now we can say that we have National Cancer Registry. And on the other side, we have, this is an enabler and facilitator for the future. And this is something that we have to focus, and we can show you what we did and how we worked to achieve this. This is very important that from the first semester of 2025, the digital transformation of 12 oncology hospitals will be implemented. This is very important because we want to have interoperability, because all these registries and all this data cannot be harnessed other way. We must connect everything together. At the same time, just yesterday, we signed an MOU with the biggest healthcare region in Greece. What does it mean? That means that we will try to implement this efficient guide and other common actions with the hospitals on the biggest health region in Greece, because this will show the results. And of course, we have strengthened the collaboration with the Ministry of Health, and we begin collaboration with the WHO Quality and Safety Regional Office, because they have knowledge and we need their knowledge on prevention and other stages. But we have some challenges. First, we have a weak healthcare system. It is not strong enough. We have lack of health system data. It is under construction, but not yet. And this is very important. We have frequent changes of governments and politicians. This is something that we'll try to address every time a minister changes. We go back 1 year at least. And of course, the most important, there is lack of clear focus on prioritizing cancer prevention and treatment from the health policy makers. So we are working at the same time to this field. With all this, I want to thank you for giving me the opportunity to present you what we did, how did we act, and what we are looking for the future. And I hope that if we can help and give you some indications that will support your efforts, it will be something very positive and we'll be happy. Thank you very much.
Well, thank you very much, George, for this presentation. You had to go fast, but I believe it was very efficient. As we said, this is what was done in one of the ALCAN entities. Every country has chosen a different way of working around the same theme, which is using what we have available today in a better way, that is efficiency. And OECD put it out already 20 years ago in healthcare, and not speaking only of cancer care, but in healthcare, the waste all over the world is about 25%. 25% of what is being done is for nothing, is just a waste of money. If you can recuperate that, imagine how much more we can do. So this was our presentation, our side. Time is running. The discussion earlier was very interesting, the comments made, the questions asked. My feeling is that we will have Hashem to organize a meeting around this, not for an hour, but for a full day in the near future.
Okay. So thank you very much, Eduardo and George and Matti. It is really interesting, and in spite, I don't see the picture very clearly, but as you suggest, it is the discussion and what we can do. And we just discussed with Dr. Heba and Dr. Ashraf that not only we love Greece, but also we are very similar to Greece. So I think there is a lot of similarity that we can. It's good to have your inputs and your experience, and I think it is important to go for another discussion and try to go for the real questions that we want and then discuss. I really have another issue, which is because of the presence of IARC team with us, which is important. I don't like usually to go for repeating actions. So I think it is IARC is one of our main partners now, and we are depending on them in a lot of things. So I want to integrate actions to have much better outcome rather than repeating something. So do you want to have any comment, Bartha? No, this one is working.
Thanks, Hashem. You mentioned that Egypt does not have the national cancer plan as yet. You must be aware of the impact mission project that IAEA, WHO, and IARC, jointly in collaboration we implement. And I'm not sure whether you have, whether the ministry has applied for an impact mission to IAEA. What we do through the impact mission is that countries can apply. The Ministry of Health has to apply to the IAEA, and then IAEA creates a group of experts, both within the country and also from outside, and together they look at the entire cancer control continuum, starting from prevention to palliation and supportive care. And then there are very specific recommendations made. Before that recommendation, there is extensive work done in terms of getting information from the country, making site visits by the different teams, having discussion with the different stakeholders, and based on that, a final recommendation is made, which can go into the cancer control plan. Of course, the impact mission per se does not create the cancer control plan, because the cancer control plan is a national, kind of something that happens within the country. But then certainly the inputs given by the impact mission can be very valuable. And in many of the countries, it has really created an enthusiasm, motivation to go ahead and complete the cancer control plan. So, we can certainly facilitate that if you want, or you can directly also talk to the IAEA and then initiate the plan of impact mission.
So do you have any comment, Matthew, on that? So, Val, you want to comment? No?
Maybe just a small point on the cancer registration, which is a hot topic. So IARC will support Egypt on the issue of cancer registration. I think there'll be a visit in March. And I think it needs to be kept in mind the purpose of different types of registries, and different types of registries have different purposes. So like a population-based cancer registry, the aim is to precisely estimate cancer incidence rates and to know, what is your most common cancer, how, the different types of cancers, what are their incidence rates in different parts of the country. And it's better to do a small area very, very, very well than a large area poorly. And I think that's the approach that IARC is going for, especially in low-income countries, doing an urban area, a rural area, carefully selected and really getting very high coverage and knowing really well what's going on. So you can then extrapolate well to the country. Separately to that, you can do very good clinical registries that'll nicely, look at, so for example, trends in staging over time, etc. But they have slightly different purposes, and I think we call them all cancer registries, but they're slightly different. But IARC is ready to support, and I think hopefully in the next few years we'll see some nice progress on that.
No, I think we may have like closing remark, maybe one comment from Dr. Heba, and because I cannot refuse anything from Dr. Heba, and then the closing remark from me.
Just one important point. I can just leave the title for discussion later on, because I feel that every time we are talking too much in a closing room and closing meeting. But I dream one day one of a senior professor like me be regulating the media. And I'm telling you that because I have a student from Uganda, and she have her master's degree in breast cancer under our supervision. And when we congratulate her and she will go, she mentioned to me that I am the only oncologist lady in my rural area. I will not practice medicine. So I was shocked. Why? We are proud of you. You are now a medical oncologist. And it's like, no, ma'am, and I will practice awareness for very poor ladies who become with their disease very in late. So my call in this meeting to join or to invite some of authority of the media in each country, because something said by our dear professor, we believe it and we can do it, but the propagation of the idea for national goal and for how the center can cooperate will be only through the community and media.
Well, you said I have the last words. I repeat what I said at the beginning. These are the first words. I would really love this to continue. It's up to you. What we did with Eduardo and with George presenting what happened in Greece is to bring our experience, to show what Allcan has been able to, in different ways, as I said, different countries have had different priorities to do. We are very proud of what happened in Greece. Another example is in Colombia, where they had major problems. Through the efforts of Allcan Colombia, not everything is solved, but solutions have been found. This is what we are here for. We want to help you, facilitate, but it's you that have to decide. It's Egypt, it's your country. We are just here to help if we can.
Thank you very much, Matti. Really, thank you very much, George and Eduardo, for helping. And we are really appreciating your efforts, not only for this, but for a lot of things. And I feel that it is now a lot of move in the oncology community in Egypt. Really, it is completely different than before. It is, we are working in group rather than personal moves now. So it is, we have the Egyptian Cancer Society now is moving very well, the Presidential Initiative for Women Health and the Presidential Initiative for other cancer, the other 4 cancers, they are presented with us. So I think the movement in Egypt is different, the political will is different. I think it is important to regulate all the actions together to have a better outcome, avoiding repetition or fragmentation. I think it is very, very, very important. I'm happy to have all the generations represented. So, so the very young generation and beside me and also the others. So I think this is important for the sustainability and the continuity of the care. Thank you very much again, and we will arrange a very close meeting with Allcan, and after taking the questions and the plans and suggestions from our team. And thank you very much, Matti, again, and George. And we can, I think we must continue the other meeting. Thank you very much. Thank you.